According to the U.S. Census Bureau, more than 56 million adults ages 65 and older live in the United States, accounting for about 16.9% of the nation's population.
An estimated 10,000 adults every single day turn 65. I'm one of them. With retirement right around the corner, it's time to consider Medicare.
That's right. There are lots of choices, so being informed is so critical, and one company is committed to focusing on the needs of our senior population.
Wow. And here with more is Caraline Coats, Humana's regional president for Florida. Welcome, and thank you so much for being with us today.
Thank you. Excited to be here.
This is really an important topic. So, Caraline, I want to start with just tell us a little bit about how Medicare works, because a lot of people out there get confused.
It is confusing. Medicare itself, original Medicare, is a federal-funded program that provides health insurance when you turn 65. And you can start to enroll in Medicare 3 months before your 65th birthday. So I encourage you kind of go out on Medicare.gov site.
I agree.
And start to research what options are out there. Do your homework. And you can enroll all the way up to 3 months after your 65th birthday. In most scenarios, you will automatically be enrolled in original Medicare, but you should go out and check and make sure that when you turn 65, you have that original Medicare coverage. And then in addition to the original Medicare coverage, there are Medicare Advantage plans that offer additional benefits beyond the hospital and the physician coverage. And all of those plans with all their different options are on the Medicare.gov site, which is where I encourage people to start and learn and first understand what your own needs might be.
And it's so important to talk about this because we talked about these numbers right off the top, and these numbers will increase, no doubt, in the next decade, I'm assuming, right?
Oh, absolutely. The statistics are staggering. In fact, in 10 years, our country, for the first time ever, will have more people living over the age of 65 than people living under the age of 18.
Wow.
Can you imagine that?
Are you kidding me?
And in fact, by 2050, we will have tripled the number of people living in their 80s, 90s, and 100s.
Amazing.
That's insane. Well, what makes it so confusing is there's so many different options out there. Can you tell us a little bit about the different types of coverage?
Yeah, so again, the original Medicare, and this is where I'll hit you with a little bit of alphabet soup. There's the Medicare Part A, which it covers all of your hospital needs. If the unfortunate event, you're in a hospital. Part B is more the medical coverage, physician office visits, that type of a thing. D are the drugs. That's the only one that kind of makes sense, right? The Medicare Part D. And so the original covers that A and B, where you can purchase the D separately. And there are no specific restraints on a provider network. So if you're seeing a doctor or you want to make sure you see a doctor, so long as he or she takes Medicare, you can go to that network. Then there's Medicare Advantage, which are the private plans like Humana and other plans out there that kind of bundle it all together. So it's the A and the B and the D, and just to make it more confusing, we call it all C. So Medicare Part C would be a private Medicare Advantage plan compared to original Medicare.
You're telling me something that I'm going, wow, that's a lot to take in. So let's say for those who are beneficiaries and they're starting out, I mean, where do they begin? Because obviously, you know, Montel's needs, well, he's not even there yet. But Montel's needs may be different from mine or yours. So where do we begin?
Yeah, and you hit the nail on the head, right? Understanding your own needs. Everyone's health conditions and needs are unique, and they're unique now, and they might be different next year in a couple of years. So I encourage you to kind of first stop and do an assessment of what you need. Do you have a chronic condition? Is there a particular physician or hospital that's really important for you or the loved one for whom you're trying to, I'm actually helping my mom through this a little bit right now. So understanding what your unique needs are, and then the first step is online, Medicare.gov. You'll learn about original Medicare there, the A and B that I mentioned, and then they also link to all the different Medicare Advantage plans. They're listed by different star ratings, so you can see from 1 to 5, there are stars that are associated with each plan that represent different quality results, and then from there you can link onto the different plans. And most of those sites will then even connect you to a phone number, you know, for that particular plan if you're interested in, and maybe could speak to a broker to kind of walk you through your options.
That's good.
For sure. Now, yeah, it's kind of crazy, but I always thought Humana was just an insurance company.
No, it's a healthcare company. I knew that.
Well, why don't you tell us a little bit about the Humana office?
So we're proud of the journey we've made and kind of going from an insurance company with elements of health to a healthcare company with elements of insurance. And we fundamentally believe that really understanding our beneficiaries' needs outside of their clinical diagnosis is really important, right? Do they have access to healthy food? Do they have safe transportation? Are they lonely? And so we try to address these needs through different benefit offerings beyond what they need just in a physician's or hospital's office. So in fact, more than than half of our employees are clinicians themselves. So it's really embedded in our DNA to connect clinically and socially with our members.
What I hear is, one size doesn't fit all. Everybody's different, but Humana really has something to offer for everyone.
We do. We offer various products kind of along a continuum, whether you want more of a gated type product, referrals, no referrals, different options. Every product is different based on where you live. So I try to meet everyone's needs. And there's that initial enrollment period that I mentioned when you turn 65. And then every year you can switch. You don't have to. Oh. But every year between October 15th and December 7th, you can do all this research again and make a different choice, as we know our healthcare needs change.
So for our viewers who'd like more information, especially me, which I'm going to get there in about 30 years?
I thought it was like 35.
Right, there you go. Thank you so much. For our viewers who'd like more information, where can they go?
Medicare.gov. It's the first stop on this confusing train, and from there you'll learn a little bit more about original Medicare and then again link to the different plan options.
Oh, but you made it so much easier for us.
Of course, if you want more information, you can also go to our website, thebalancingact.com. Thank you so much for being here and being a part of the show today.
Thank you.
Really
Great opportunity.
Thank you. And we'll be right back.